I'm Mark Grabarczyk. I'm an interventional cardiologist with Upstate Cardiology.
Dr. Grabarczyk, I understand you spend a lot of time in the cath lab at St. Francis performing heart catheterizations. Exactly what is a heart cath?
A heart catheterization is an actual study we perform in the hospital where we actually evaluate the patient's heart artery.
What are the symptoms someone would experience that would necessitate a heart cath?
Heart catheterizations are indicated for patients who are experiencing symptoms that would be worrisome for heart artery blockages. The most common symptoms for coronary artery disease are shortness of breath, chest pressure, chest pain, and sometimes even feels as indigestion.
What procedures are in place to treat blocked arteries?
It's generally performed one of two ways. Radial heart catheterization is actually the process in which we do the heart catheterization through the wrist. We use a little slightly different technique than when we go through the leg. But traditionally the process, once we put the tube in the arm, is essentially the same. We can selectively put catheters in each of these arteries and then image these and look for blockages.
So you can perform the heart cath through the wrist, which is the radial approach, or the leg. How do you choose?
But there are certain circumstances, depending on how ill and sick the patient is, that may warrant going through the leg.
So what are the advantages of the radial approach?
The benefits from radial heart catheterization traditionally, for the most part, are patient comfort and patient safety. The radial heart catheterization approach allows the patient to immediately sit up after the procedure, allows the patient to immediately walk, less bleeding and less complications after the heart catheterization with the radial approach. The advantages of the radial approach does allow the patient to recover at home.
This has certainly been informative, Dr. Grabarczyk. The St. Francis Heart Center, located at St. Francis downtown in Greenville. For more info, go online to stfrancishealth.org.